I have the gene for cancer, as it's called. It's BRCA1, which meant that I had to have my ovaries removed. It was about 10 years ago now, at a very young age. So I plunged into what is known as a surgical menopause. And because they wanted to remove my ovaries, because I've got a high risk factor for female cancers, basically. So after I had my second child, I thought, well, I don't need these anymore. Went to the consultant and they whipped them out. The aftermath of that was horrendous because I evidently had absolutely no hormones left in my body whatsoever. I did not realise the impact of that would have on me physically, emotionally, mentally, my ability to function at work, my ability to function in relationships, how it impacted my friendships because I'd changed so much and was just struggling with everything. The only thing that was easy to do was breathe, I would honestly say, for a long time. So I probably assumed that my symptoms would be 10 to 20 times worse than a lot of women who experience the menopause, but I appreciate that there are serious symptoms and it's a spectrum of symptoms for people. The consultant basically sent me off without any HRT at all. And he said, what you do is you go to your GP and you just get some HRT. Right. So I went to the GP and got some HRT and it just wasn't strong enough. And I couldn't function. So it was so bad, I just couldn't explain how I felt. I didn't know what was happening. My brain wasn't functioning. I couldn't speak properly. I had severe brain fog. I couldn't remember anything. I'd lost all my confidence. I developed anxiety. I was depressed. So even asking for help from a GP was really, really difficult. And I think 10 years ago is actually quite a long time now. I think there's much more awareness about menopause now. I literally had no idea what was happening. Um, and could it have been just postnatal depression? Could it have been dementia? I don't know. Anyway, yeah, so I went to the doctor and got some patches, and it was just basically the start of 5 to 7 long years of not feeling very good, because it just takes so much time to tweak your dosages, and I evidently and obviously needed the maximum dose because I was young and I had nothing, no hormones in my body, and unfortunately, well, I was fortunately because I'm linked to Manchester. The research with the sort of cancer gene people, they connected me to a menopause specialist, which was amazing. So went there and they were like, you've got this symptom, that symptom, this is what you need, this is what you can do. And I was like, this is the holy grail. It was amazing. So she really, really helped. The problem with that is that there's about a year or a year and a half or maybe even 2 years waiting list. So you're struggling the interim before you get that help. And I was struggling a lot. I was a single parent. I had 2 young children. I was working full time. I shouldn't have been in work, but I just think I was like a zombie and just being, my relationship broke down. I was probably like, people must have thought I was weird or ignorant because I couldn't communicate. I was forgetting my words at work, couldn't do presentations, couldn't remember my own name. So although the menopause specialist is absolutely fantastic, I think it's a shame that there is a wait for it. And I also think if there's more just warning really about from my situation where I had my ovaries removed, I was not warned about these symptoms at all. Ultimately, I think for the doctors, they were just like, right, you've got really high risk of cancer, get them out. That was their priority, which was to save my life, because you can't have scans for ovarian cancer. You've just got to get rid of it if you've got such a high risk. So since then, things, obviously your hormones change and your body changes. My GP actually, I think I'm quite an interesting case to her. So she's actually been really, really supportive. For example, they have prescribed me testosterone, which helps my brain function better, and I'm stronger because of it. And they're really, really supportive. I have to say, Lancaster, the area, they're fantastic. And I have bobbed in to Manchester a few times to see the menopause specialist, and they have tweaked the amounts that I need. But just to put in this perspective, this happened 9 years ago, and I've only really started to feel normal in the past 6 months. So it's a long process, but that's why women need support, they need information, and they need, yeah, menopause specialists and GPs that are understanding and just know all the symptoms and can reassure women that they're not going mad. This is natural, but there is help out there.
My name's Claire Scrimshaw. I'm 41 years old. My journey began when I was around 12 years old. So I started with endometriosis quite soon after I started my periods. I can remember it was really, really painful, very debilitating. So I took time off school, which then fed into college and university as well. So it gets to the point where I couldn't even use the toilet because I was in so much pain. But the doctors unfortunately sent me backwards and forwards for that amount of time before I was diagnosed, just saying that it was kind of normal and down to heavy periods. Um, I was 24 when I was finally diagnosed with endometriosis after a laparoscopy back in when I lived in London. Uh, and so that was quite a scary diagnosis because I didn't know what it meant. It wasn't explained to me what that would mean. As far as I was aware, it was almost like it was kind of like a cold, and it was something that I could get rid of. Um, I was given 6 months of Zoladex injections and kind of sent on my way with that. And then, as far as I was aware, that would be the end of it. Unfortunately, my endometriosis was persistent and came back several times. So I've used Prostat injections. I've had 4 laparoscopies to try and remove the endometriosis through excision and also through um, kind of burning the tissue away as well. And I became the age, I think I was 32, and we'd gone through all of this kind of surgery and medical menopauses. And I got to the point where I was just tired, really, really tired of it. And there was nothing that was kind of being done that helped me get my life to a point where I could live day to day well. Um, so they decided that the best course of action would be to remove my ovaries. So when I was 33, they removed my ovaries. Um, However, I still had problems with pain. So 6 months later, they removed my uterus as well, and my cervix. So now I don't have anything at all. Um, yeah, so that's kind of my experience. And now, when I got into menopause, unfortunately, I was left for a few months, and I didn't see a menopause consultant. So I wasn't given any HRT, and only being 33 at the time, I was told that I would need HRT for my bones to protect them in the long run. I did complain about that and finally got round to seeing a menopause consultant and was put on some gels. Um, and I've tried patches, gels, and I'm now looking to maybe try and get an implant because I don't seem to absorb them, unfortunately. So at the moment I'm kind of freestyling and I don't have anything. So I'm just waiting for news on an implant. Um, so that's my story. I would say that the information that is given to women is very minimal in terms of when it comes to what's next and what's kind of, what's happening to your body. Why is it happening to your body? Is it something that you can get rid of? Is it something that you will have to live with? These things need to be really clarified for women, and I think that there are certain things, especially around endometriosis, that need to be changed. So I remember, Sue, when we spoke, I spoke to you about um, the importance of looking at how women who have reproductive problems, such as endometriosis or maybe PCOS, or them kind of things where women struggle to get pregnant or there's fertility issues. Um, they seem to be sat in hospitals in waiting rooms next to pregnant women, and for me that was really painful. So because I would have liked to have tried for a family, but I didn't have the option. Unfortunately, we didn't have that window of where I was well enough to try. So going to an endometriosis appointment and sitting in a room full of really pregnant women was really painful. Yeah, both me and my husband, I would say, because he didn't get a chance to be a father either. And I think that yeah, there should be a lot more in terms of awareness around these things and topics. So PCOS, endometriosis, premenstrual dysphoric disorder, so PMDD. That's a really severe form of PMS, which I've supported women in previously as well. So this can kind of lead to suicide, which is yeah, about 3 to 5% of women that live with that. So that's another area, mental health, that's really important as well whilst living with these conditions. Um, and I think that's not really thought about sometimes. In terms of menopause, I think that it's becoming more mainstream, but there are still issues around women going into doctor's surgeries and they're being offered antidepressants as the first line of action, where it should be really HRT and looking at the absence of estrogen. And yeah, so going away with antidepressants isn't going to fix that, unfortunately. And I've had quite a few complaints from women that I've spoken to about being sent away with antidepressants and not being heard. And I think that's a big problem in women's reproductive health, just not being heard, not having a voice. So it'd be really good if maybe consultants and nurses and doctors could just listen a little bit better, maybe absorb the information that they're being given, and just give a little bit more time. I know time's precious in the NHS and also across all settings, in terms of hospital care and doctor's care, and but it's just giving that little bit more time to understand, and diagnose properly and give the correct treatments, um, in order to give that person an opportunity to live well with what they have. I think that's really, really important.